Welcome to the Nursing World NCLEX content review class. Today we'll be looking at diagnostic tests. This is part one of a two-series presentation. We'll be looking at urinary system tests, reproductive tests, neurological tests, liver function tests, GIT tests, and blood tests. As usual, we'll start with a quiz. A client with suspected renal disease is to undergo a renal biopsy. The nurse plans to include which statement in the teaching session? You will be sitting for the examination procedure. Portions of the procedure will cause pain or discomfort. You will be asleep during the procedure. You will not be able to drink fluids for 24 hours following the procedure. Okay, if we evaluate all our answer option choices, we'll find out that answer option B is correct. Portions of the exam are painful, especially when the sample is being withdrawn. So this should be included in the session with the client. Answer option A is incorrect because the client will be positioned prone, not in a sitting position for the exam. Anesthesia is not commonly given before this test, making answer C incorrect. And answer D is also incorrect because the client can eat and drink following the test. So I hope that got us warmed up. So first urinary system test we'll be looking at is urinalysis, which is done to detect kidney abnormalities. So prior to the test, you want to advise the client to save the first morning specimen. You know, overnight specimen is more concentrated and the normal value ranges from a pH of 4.5 to 8. And again, you need to be conversant to your normal specific gravity for urine, which is 1.010 to 1.030. Okay, please take that down, 1.010 to 1.030. That's your normal specific urine gravity levels. Okay, another test we'll be talking about under the urinary system test is the urine culture and sensitivity test, which is done to identify bacteria in urine. So prior to the test, you want to cleanse the external meatus with povidone, iodine, or soap and water before the test. And again, you want to obtain midstream specimen if you are doing a urine culture and sensitivity. And the normal value with this test should be less than 100,000 colonies per mil. Okay, there's also cystometogram, or what we call CMG. This is a test used to look for problems with the filling and emptying of the bladder. Cystometry measures the amount of urine in the bladder. It's a test of muscle tone. Okay, so preparing your test or preparing your client, you need to prepare the client for Foley catheterization, and then there'll be instillation of saline. And once this is done, it may cause a feeling of pressure in the bladder during the test. So you need to educate your client about this. And at the end of the test, you want to advise the client to report any post-test symptoms. We also have cystourethrogram, which is an X-ray study of the bladder and the urethra. So please, you want to explain the procedure to clients. Catheter is inserted into the urethra, and a radiopeg dye is then injected, and then the client will be asked to void, and as he's voiding, x-rays will be taken. At the end of the test, post-test, part of your nursing care, advise the client to report any symptoms. Okay, we can also carry out creatinine clearance, which is also part of the urinary system test. Creatinine clearance test measures creatinine levels in both a sample of blood and a sample of urine from a 24-hour urine collection. It's done to evaluate renal function. So there's a 24-hour urine collection, and blood is then drawn for creatinine level at the end of the urine collection. And normally, the normal range should be between 1.42 and 2.08 ml per minute. Well, that's for mils. Again, we also carry out the BUN, which is also done to evaluate renal function. You must understand that the values of this BUN can be affected by protein intake, It could be affected by tissue breakdown. It could be affected by fluid volume changes. Again, your normal values for your BUN should be between 10 and 20 milligrams per DL. So you need to know all of these laboratory values. For me, I think of bond as the bonds they sell by the roadside. I know bonds is between 10 and 20 naira. So that helps me to remember. Once I see BUN, I think of bonds and I think of 10 to 20 naira. And that's what my normal BUN level should be. Okay, there's cystoscopy, which is a direct visualization. You know, you want to use a cystoscope. Okay, so these are cystoscope here. So it's used to directly visualize the bladder and the urethra. So part of your preparations, you need to prepare the bowel. You need to teach the client to deep breathe to decrease discomfort, and it would also be kept NPO if general anesthesia will be used. Now, at the end of the test, you want to monitor the character and the volume of urine. You also want to check for abdominal distension, urinary frequency, fever. And again, it's expected that the urine usually might be pink tinged. There may be some pink discoloration to the urine that will be expected. Abdominal or pelvic pain should not be expected because that would indicate some trauma. And you want to provide antimicrobial prophylaxis. Okay, we can also carry out intravenous pyelogram as part of our urinary system test. Okay, so this provides X-ray visualization of the kidneys, urethra, ureters, and bladder. We also carry out bowel preparation. Patient would be kept nil per oral after midnight. Again, you want to check for allergies to shellfish or iodine or chocolate or egg or milk. And you also want to indicate to your client that there might be some burning or reports of salty taste that might occur during injection of the radiopeg dye into his vein. So he should be educated on this. And then X-rays are taken at intervals after the dye is injected. Post-procedure X-rays usually done. Clients should be alert to signs of dye reaction. What dye reactions do we know? You can see itching, there could be wheezing, there could be dyspnea, there could be edema. So you need to look out for these signs, and you also need to educate the client to watch out for these signs. Okay, so we can also carry out renal scan to evaluate the kidneys. Usually fluids are forced before this procedure. A radioactive isotope is injected IV, and radioactivity is measured by a radioactivity counter. We can also carry out ultrasound scan, which shows us images of renal structures that could, the ultrasound scan works by sound waves to produce those images you see on the screen. It's a non-invasive procedure. No preparation is required, but a full bladder might be required. So that would be our renal scan, and that would be our ultrasound scan. We could also carry out a kidney biopsy. So here you can see the biopsy being done. An ultrasound transducer is used to locate the position of the kidney while a sample is being collected. So the purpose of this kidney biopsy or percutaneous kidney biopsy, whichever you choose to call it, kidney tissues are obtained by needle aspiration for pathological evaluation. So this is your needle biopsy, or your biopsy needle, which is used to collect samples. For this test, the patient might be kept. Okay, so the patient might be kept nil per oral 6 to 8 hours. X-ray taken prior to the procedure. The skin is marked to indicate lower pole of the kidney. On the lower pole, you have fewer blood vessels, or an imaging device such as this helps guide the needle into the kidney to remove tissue. Usually the patient is kept in a prone position and the client is instructed to hold his or her breath during needle insertion. A part of our post-test nursing care, we want to apply pressure to the site for 20 minutes. Again, you want to keep the client on the affected site for between 30 and 60 minutes. Apply your pressure dressing. All of this is to reduce the risk of bleeding. And then you want to check vital signs every 15 minutes for 1 hour. Keep the client in bed, probably bed rest for 6 to 8 hours. Intake should at least be 3,000 ml per day. Observe for hematuria, and also site bleeding. We can also carry out the Schilling test, which diagnoses vitamin B12 deficiency or pernicious anemia. Radioactive vitamin B12 is administered to the client when you want to carry out this procedure. And low value excreted in urine indicates pernicious anemia. Normal value is greater than 10% of the dose that is excreted in 24 hours urine. So low value would indicate pernicious anemia. Most times, if the patient has this condition, he might be prescribed vitamin B12 injection for life, which is your cyanocobalamin injection. So you can see injection of radioactive vitamin B12 given or by mouth, and then urine samples are collected for 24 hours. Okay, so let's go into reproductive tests. And as usual, we'll start with a quiz. The client asks the nurse how the healthcare provider could tell she was pregnant just by looking inside. What is the best explanation by the nurse? A, bluish coloration of the cervix and vaginal walls. B, pronounced softening of the cervix. C, clot of very thick mucus that obstructs the cervical canal. And D, slight rotation of the uterus to the right. What's our correct answer here? A bluish coloration of the cervix and the vaginal walls. You know, this is our Chadwick sign. You can see that's bluish discoloration, bluish purple coloration actually. So this is what we call your Chadwick sign, occurring at about 4 weeks of pregnancy, that is caused by vasoconstriction. And that's how the healthcare provider is able to determine that the client is pregnant with this sign, which is called your Chadwick sign. So one test we can start with our reproductive test will be colposcopy. So here you want to visualize the ovaries, the fallopian tube, the uterus, and you're using a lighted tube. You can see this tube, it has a light at the tip, which is inserted into the vagina and through the cul-de-sac. Prior to testing, local anesthetic may be used or light sedation, and the patient is kept in a knee chest position during the procedure. At the end of the procedure, you want to position on abdomen after procedure. Observe for vaginal bleeding, and you want to advise the client to avoid douching and intercourse for 2 weeks. No douching and intercourse for 2 weeks. Douche usually refers to vaginal irrigation, you know, the rinsing of the vagina, but it can also refer to the rinsing of any body cavity. So they want to avoid that for at least 2 weeks. There's colposcopy, which is a procedure similar to a pelvic examination, and it's done using a colposcope. So that's your colposcope there to closely examine the cervix, the vagina, and vulva for signs of disease. Colposcopy may be recommended if pap test results is abnormal. So it's usually performed between menstrual periods. Usually takes like maybe 20 minutes. Patient is kept in a lithotomy position. Cervix is washed with dilute acetic acid. Okay, if we look at laparoscopy, which is performed for visualization of pelvic cavity through an incision beneath the umbilicus to view structures. Usually carbon dioxide is introduced into the abdomen to enhance visualization. General anesthesia may be used, and a Foley catheter is inserted for bladder decompression. Patient can be out of bed after procedure and can resume regular diet. So that's part of our post-nursing, post-test nursing care. We could also carry out cultures and smears, which is to take samples of tissue to identify infectious processes or identify abnormal cells. Your preparations, no anesthetic needed. Although chlamydia smear needs media preparation by the laboratory, so you should be aware of that. For a cervical biopsy, sample tissue is taken to identify unusual cells. So you can see your vaginal speculum, and this is your biopsy forceps, which will be used to take samples from maybe the uterus. No anesthesia used. Client may experience cramping sensation, so you need to educate her on this. And your post-nursing care, provide written instructions on the procedure. There should be restrictions on intercourse, douching, and swimming for at least 3 days after this procedure. Okay, the next system test we'll be looking at will be neurological tests, and as usual, we want to start with a quiz. The physician has ordered a lumbar puncture for a client with suspected Guillain-Barré syndrome. The spinal fluid of a client with GB syndrome typically shows A, decreased protein concentration with a normal cell count, increased protein concentration with a normal cell count, increased protein concentration with an abnormal cell count, D, decreased protein concentration with an abnormal cell count. Remember, GB syndrome is a condition in which the immune system attacks the nerves. So this should be our normal nerves. And you can see the immune system is eating up the nerve, usually triggered by an acute bacterial or viral infection. Symptoms start as weakness. The patient or client begins to experience some weakness and tinglings in the feet and legs, and this spreads to the upper body. Paralysis can occur. Special blood treatments like plasma exchange and immunoglobulin therapy can relieve symptoms. Physiotherapy could also help. So our correct answer would be B. The spinal fluid of a client with GB has an increased protein concentration with normal or near normal cell counts. Answer C, A, and D are incorrect statements, so they are wrong. Okay, let's take another quiz. A 5-month-old infant is admitted to the ER with a temperature of 103.6 Fahrenheit and irritability. The mother states that the child has been listless for the past several hours and that he had a seizure on the way to the hospital. A lumbar puncture confirms a diagnosis of bacterial meningitis. The nurse should assess the infant for periorbital edema, tenseness of the anterior fontanelle, positive Babinski reflex, negative scarf reflex. Also, remember that bacterial meningitis is an inflammation of the brain. Okay, it's an inflammation of the brain and spinal cord caused by infection, your Neisseria meningitis, your Listeria monocytogenes, your Haemophilus influenza, your Streptococcus pneumonia. So vaccines can prevent some form of meningitis actually, but if you have a patient who comes down with this, you will see symptoms such as headache, fever, and the classical stiff neck. So you have that stiff neck. Although depending on the cause, meningitis may get better on its own, or it can be life-threatening, requiring urgent antibiotic treatment. For this question, option B would be the correct answer choice. So tenseness of the anterior fontanelle indicates an increase in ICP, or your intracranial pressure. Periorbital edema is wrong because it's not associated with meningitis. C is also incorrect because we actually expect to see a Babinski reflex in this infant. So that's normal. So C is also wrong. And D is also incorrect because it relates to preterm infants, not infants with meningitis. So let's look at cerebral angiography, which helps to identify aneurysms, vascular malformations, narrowed vessels. So you can see all of the vessels in the brain. So if there's any occlusion or narrowing or aneurysm, it would light up on your cerebral angiography. Part of your pre-procedure, you want to inform the client, you want to explain the procedure to the client. You will tell him he's going to need to lie flat. A dye will be injected into his femoral artery. Fluoroscopy and radiologic films are taken afterwards, after the injection. So you want to keep him well hydrated. He might be given pre-procedure sedation to keep him calm. The skin is prepped and the chosen site will be shaved. So you want to mark peripheral pulses. And again, you need to educate the client that they may experience a feeling of warmth and metallic taste when the dye is injected. Part of your post-test nursing care, you want to carry out neurological assessment every 15 to 30 minutes until vital signs are stable. You want to keep flat in bed for at least 12 to 14 hours. You check the puncture site every hour. Immobilize the site for 6 to 8 hours. Assess distal pulses, color, and temperature. Okay, you want to know what's happening after the insertion site. So you want to assess distal pulses, the color, temperature. Again, observe symptoms of complications or allergic response to the dye that was used in the procedure. Look out for puncture site hematoma. Again, you might need to force fluids to help clear the dye from the system and also keep accurate intake and output for your patient. Lumbar puncture, here you can see we insert a needle into the subarachnoid space to obtain specimen, to relieve pressure, to inject a dye or medication. That's usually why we'll carry out the lumbar puncture. Again, you want to explain the procedure to the client, get informed consent. Procedure is usually done at bedside or in the treatment room, and the patient could be positioned in a lateral recumbent fetal position at the edge of the bed, such as this. Could also be done in a sitting position. Part of your post-nursing care will include, again, neurological assessment every 15 to 30 minutes until stable. You want to position flat for several hours. Encourage PO fluids to at least 3,000 mils. We might need to give him oral analgesics for the headaches that could occur after the procedure. And again, observe sterile dressing at insertion site for bleeding, or you're looking out for drainage. Your EEG, or electroencephalogram, records electrical activity happening within the brain. Again, please explain the procedure to the client. Procedure is usually done by a technician in a quiet room. It's painless. Tranquilizers and stimulant medications, if the patient is on any of these, it has to be withheld for 24 to 48 hours pre-EEG. Again, stimulants such as caffeine, cola, tea, if he smokes, all of these have to be withheld for 24 hours pre-EEG. Tell the client that he may be asked to hyperventilate 3 to 4 minutes. He may be told to watch some bright flashing lights. This is normal and it's part of the procedure, so you should expect that. It should be expected. Again, meals are not withheld for this test, and patient is usually kept awake night before the test. And after the test, you want to help the client remove the paste from his hair. paste that was used to attach all of the leads or the electrodes on the patient's scalp, administer prescribed medication. Again, you want to observe for seizure activity in seizure-prone clients. So this is what your EEG readings will look like. Okay, so we also have echoencephalography, which evaluates brain structure through sound waves. As usual, for any procedure, you want to explain the procedure to the client, and you inform them that a handheld transducer will be used to record the sound waves, and then the results will be interpreted by the specialist. There's also your PET test, or the positron emission tomography. This is used to assess metabolic and physiological functions of the brain. You could also use it to diagnose a stroke, a brain tumor, epilepsy, Parkinson's disease, and head injury. So a client inhales or is injected with radioactive substance, and then you carry out your scan. Tell the client he may experience dizziness, headaches, and also you want to teach him relaxation exercises to keep him calm. We also carry out a CT scan or a computed tomography scan to detect hemorrhage, infarction, cerebral infarction, abscesses, tumors. Again, informed consent is required. Educate your patient on the procedure. Let him know it's painless. Let him know he will be immobile during the exam. And again, if contrast dye is used, he needs to expect that feeling of flushed, warm face, and also a metallic test during injection is all normal. Part of your post-nursing care includes assessing for allergic responses to the contrast dye. Again, we said some of these allergic responses will be manifested like in the form of rashes, pruritus, urticaria. And again, you want to encourage peroral fluids. Okay, another neurological test will be your myelogram, which visualizes spinal column and subarachnoid space. A myelogram is a type of radiographic examination that uses a contrast media to detect pathology of the spinal cord, including the location of a spinal cord injury, cysts, tumors. So you use this to visualize, like I said, to visualize the spinal column and the subarachnoid space. Again, informed consent is required. Explain the procedure. You want to keep the client nil per oral for between 4 to 6 hours before the test. Obtain allergy history. Phenothiazines, CNS depressants, and stimulants should be withheld for 48 hours prior to the test. Again, you need to inform the client that the table will be moved to various positions during the test. So that should be expected. As part of your post-nursing care or post-test nursing care, you want to carry out neurologic assessment every 2 to 4 hours. Again, when metrizamide water-soluble dial is used, the head should be raised 30 to 45 degrees for 3 hours. Oral analgesics can be given for headaches that could be experienced after the procedure. Encourage peroral fluids. Assess for distended bladder. Inspect the injection site for bleeding, drainage. Again, you also want to assess for allergic responses to contrast dye, such as the rashes, pruritus, urticaria, and all of that. So good, we're making progress. And we're now at diagnostics tests, which include the liver function test. So let's start with a quiz as usual. An adolescent client with cystic acne, so you can see this very big one here. So this patient has cystic acne, has a prescription for Accutane or isotretinoin. Which lab work is needed before beginning the medication? Do we need to do a complete blood count, clean cache urinalysis, liver profile, or a thyroid function test? Well, cystic acne is a very serious form of acne, and it develops when cysts form deep underneath the skin. This can result from a combination of bacterial, oil, and dry skins that get trapped in the pores of the skin. Although anyone can actually develop acne, cystic acne tends to occur in people with oily skin. So our correct answer option would be C. Accutane is made from concentrated vitamin A, which is a fat-soluble vitamin. And we know that fat-soluble vitamins have the potential of being hepatotoxic. So a liver panel is needed. Answers A, B, and D do not relate to therapy with Accutane, therefore they are incorrect. Okay, another quiz. A client with hepatitis C who has cirrhosis has just returned from a liver biopsy. The nurse will place the client in which position? Again, when we talk about positioning in the NCLEX, you don't need to cram all of the positions. You just need to understand what do I need to achieve by putting this patient in this position or that position. Okay, so if we go back to the question again, we know that cirrhosis is a late stage of fibrosis or scarring of the liver that is caused by many forms of liver diseases and conditions like hepatitis, chronic alcoholism. So if we look at all of the position and we look at where the liver is located on the right upper quadrant. So I want to keep my patient on the right side line. You know, we want to put pressure on that area where the sample was collected from. So remember, hemorrhage can occur with liver biopsies. So the client is positioned on the right side to keep pressure on the area and prevent bleeding. All other options will not help me to prevent bleeding from the client. So like I said, use your decision tree, understand what your topic or the question topic is, and then you can get your answers correctly. So let's look at another quiz. So we can see a normal liver here, and we can see a liver that's drilled in with hepatitis, okay? So a client with hepatitis C is scheduled for a liver biopsy. Which will the nurse include in the teaching plan for this client? The client should lie on the left side after the procedure. So which would the nurse include? Again, already from the last question, we saw that we don't want this client lying on the left side. We want him on the right side, so this is wrong. So again, you need to evaluate all of your answer option choices. And we know that there's a risk of bleeding with liver biopsy. Laboratory tests should be done to determine any problems with coagulation before the biopsy. So I'll go with answer option C, because we know bleeding is a very, very high risk. All other answer options, A, B, and D, are incorrect. Lying on the right side, no. Lying on the left side, that's wrong. No enemas are given for biopsy, that's wrong. The test is invasive, so saying it's non-invasive and it doesn't cause any pain, that's also wrong. Okay, so the first test we'll be looking at will be our pigment studies. With your pigment studies, you evaluate the parameters of hepatic ability to conjugate and excrete bilirubin. Remember, bilirubin forms after red blood cells are broken down, which then travels to the liver, gallbladder, and digestive tract before they are being excreted. So we want to look at the hepatic or the liver's ability to conjugate and excrete bilirubin. Usually, the levels are abnormal when you have issues in the liver and the gallbladder. Example with jaundice. So you will see like direct bilirubin levels increasing when there is obstruction. Okay, so to carry out this test, you want the patient to fast for at least 4 hours. And what are our normal levels? Your normal serum bilirubin levels for the direct bilirubin should be between 0.1 to 0.4 milligrams per dl. For total bilirubin, serum total bilirubin, your level should be between 0.3 to 1 milligram per dl. And most times, over 70% of the liver parenchyma may be damaged before liver function test becomes abnormal. Okay, so we can also do a bilirubin test, which is done to detect presence of bilirubin due to hemolytic or liver disease. Okay, so we already saw all of these values. We said the total bilirubin level should be between 0.3 to 1.0 milligram per DL. Our direct bilirubin, the conjugated, should be between 0.1 to 0.4. And our indirect, the unconjugated bilirubin level should be between 0.2 and 0.6 milligram per DL. Another liver function test we should look at would be our coagulation studies, which include your PT and your PTT. And your PT would be what? That will be your prothrombin time, which measures the number of seconds it takes for a clot to form in a sample of blood after you add the reagents and all of that. So the PT is often performed along with a partial thromboplastin time, which would be your PTT. And together, they assess the amount and function of proteins called the coagulation factors that are important part of proper blood clot formation. So you will see the levels prolonged in hepatic disease. In liver disease, PTT is prolonged due to a lack of vitamin K. So your normal PT level, your normal prothrombin time level should be between 9.5 to 12.0 seconds. For PTT, the lower limit is between 20 to 25 seconds, and the upper limit of normal is between 32 and 39 seconds. So you need to know these values. So PT, 9.5 to 12.0 seconds, and PTT, lower limit of normal, between 20 and 25 seconds, upper limit of normal, between 32 and 39 seconds. So part of your post-test nursing care would be, remember, you need to put the specimen in ice after it's been collected. And again, you want to apply pressure to site for 5 minutes. You can increase that to about 15 minutes if the patient is on anticoagulants. Okay, we could also carry out protein studies for serum albumin. You will remember that proteins are produced by the liver, and the levels may diminish in liver diseases or hepatic diseases. Severely decreased serum albumin would result in generalized swelling, generalized edema. Again, you need to know what your normal levels are, which should be 3.5 to 5.5 grams per DL. We could also look out for liver enzymes, which are other tests we can carry out, tests for liver enzymes. With damaged liver cells, enzymes are released into the bloodstream, so you can look out for those enzymes. And we should also know what the normal values for these enzymes are, like your aspartate transaminase or your aspartate aminotransferase. So normally the AST, the ALT, for males, the range should be between 10 to 40 units. Most textbooks will give you different values, but this is a range between 10 to 40 units. And for your lactate dehydrogenase, your LDH, the normal range should be between 90 and 176 units per liter. For your blood ammonia, your arterial blood ammonia, you also remember that liver converts ammonia to urea. But with liver disease, the ammonia levels don't get converted, and the levels begin to rise in the body. So the normal levels for blood ammonia should be between 15 to 45 micrograms per deciliter. Another liver function test is our liver scan, usually done to demonstrate the size, the shape of the liver, to visualize scar tissue, cysts, or tumors. Most times it could be done with a radiopaque dye. Again, you want to question the client about seafood or iodine allergy before a radiopaque dye is administered. Anaphylaxis is common. An aqueous-based dye is also available for hypersensitive individuals. So you don't want to use a regular dye, you can use an aqueous-based dye for individuals who are hypersensitive. Okay, you can also carry out a cholecystogram or angiography. This is usually done for gallbladder and bile duct visualization. Again, radiopaque materials is injected directly into the biliary tree. Question client about seafood or iodine allergy. Very important. Once there's any radiopaque dye in play, you want to make sure you question about allergy. Again, the client is kept on a fat-free dinner or is given a fat-free dinner evening before the exam. Injection of the dye in tablet form, like your telepack tablets, evening before. Is also kept on nil per oral after dye injection. Then X-rays followed by injection of the high-fat meal, followed by further X-rays. We can also carry out a celiac axis arteriography. It's also done for liver and pancreas visualization, uses a contrast media of organic iodine. Like we said, ask the client about any allergies before you administer the dye. Anaphylaxis is also common. We can also carry out a splenoportogram or a splenic portal venography. You do this to determine the adequacy of portal blood flow. It also uses a contrast dye of organic iodine. As usual, question client about allergies, as anaphylaxis is also common. We can also carry out a liver biopsy, which is a sampling of tissue by needle aspiration. So you can see the needle as sampling the liver. Okay, we want to administer vitamin K by intramuscular route to decrease chance of hemorrhage. So that's part of your pre-care. Again, the client is kept nil per oral morning of exam for at least up to maybe 6 hours. Sedative administration could be given just before the exam to keep him calm. Also need to teach the client that he'll be asked to hold his breath for 5 to 10 seconds. This procedure can be performed at the bedside, in supine position, or lateral with the upper arms elevated. After the test, you want to position the client on the right side for 3 to 2 hours, or 2 to 3 hours with pillow under the costal margin. Again, you want to put pressure to avoid or prevent any bleeding. You need to carry out frequent vital signs to detect hemorrhage and shock. Check clotting time, check platelets, check hematocrit levels. Again, it's expected that you could have mild local pain or mild pain radiating to the right shoulder. That's also expected. Client should report any severe abdominal pain immediately because it may be an indication of perforation of the bile duct or peritonitis. So he needs to report that immediately and avoid heavy lifting for at least 1 week. Okay, so let's move to gastrointestinal tests and we'll start with a quiz. The nurse is caring for a client with a suspected peptic ulcer. The nurse caring for a client with a suspected peptic ulcer recognizes which exam as the one most reliable in diagnosing the disease. Upper gastrointestinal X-ray, gastric analysis, endoscopy, barium studies. Well, all of the tests listed can be used to diagnose an ulcer, but an endoscopic exam is a sure way or is the only way to obtain accurate visual evidence. A, B, and D are not as accurate or reliable, which makes them incorrect. So we know that the peptic ulcer is a sore that develops on the lining of the esophagus, of the stomach. So you can see the sores in the stomach. Again, it can also develop in the small intestine. And ulcers occurs when stomach acid damages the lining of the digestive tract. Common causes include bacteria like your H. pylori and anti-inflammatory pain relievers like your aspirin. Upper abdominal pain or epigastric pain is a common symptom. And treatment usually includes medication to decrease stomach acid production. If it's caused by bacteria, then antibiotics may be required. A nurse is working in an endoscopy recovery area. Many of the clients are administered midazolam or vest to provide conscious sedation. Which medication is important to have available as an antidote for VEST? Diazepam or Valium, naloxone or Narcan, flumazenil or romazicon, Florinef or fludrocortisone. Answer C is actually correct. VAST is used for conscious sedation. It's also an anti-anxiety agent. And the antidote for VAST is romazicon, which is also a benzodiazepine. So A, B, and D are not used as antagonists for VAST. However, answer B is the antagonist for narcotics. So you also need to know that naloxone is an antagonist for narcotics. So let's look at gastrointestinal endoscopy, which is the visualization of esophagus and the stomach by means of a lighted tube. So that's a lighted tube or a lighted flexible fiber optic tube that is introduced through the mouth to the stomach to determine the presence of ulcerations, tumors. You can also use it to obtain tissue or fluid samples. Part of your preparation before the test, you want to verify that informed consent from client has been obtained. You want to maintain nil per oral before procedure, at least 8 hours. Again, you want to teach the client about numbness in the throat due to local anesthetics that is going to be applied to the posterior pharynx. This is usually applied using a spray or by gargle. So the numbness in the throat should be expected for this procedure. Part of your post-test nursing care, maintain nil per oral until gag reflex returns because of the local anesthetic that was used. So maintain nil per oral until gag reflex returns. Observe for vomiting of blood or respiratory distress. Okay, you want to catch that or nip it in the bud. Then you want to inform the client to expect sore throat for 3 to 4 days after the procedure. That is also expected. That's part of your patient education. Another test we could look at is the sigmoidoscopy or proctoscopy. Here you directly visualize the sigmoid colon, the rectum, the anal canal. So you can see the screen. So that's a direct visualization of the lower digestive tract. So part of your preparation, you want to give a laxative the night before exam and enema, or even a suppository morning of the procedure. And then you want to keep him nil per oral at midnight. So part of your post-test nursing care include allow the client to rest after the procedure, observe for hemorrhage or perforation, and again, you want to encourage fluids. If we look at colonoscopy, which is also another direct visualization of the colon, used as a diagnostic aid. It could be used to remove foreign bodies, polyps, or tissue for biopsy. You want to give the client clear liquid diet 24 to 72 hours before the exam, or depending on the healthcare provider's order. You can also give cathartic, which is a purgative. A cathartic is a substance that accelerates defecation. This is in contrast to a laxative, which is a substance that eases defecation, usually by softening the feces. So it is possible for a substance to be both a laxative and a cathartic. So for this procedure, you want to give a cathartic, which is a purgative, on the evening for 2 days prior to the exam. Then we can also give an enema on the morning of the exam. Polyethylene glycol solution would be used to cleanse the bowel, and clear liquid diet the noon day before the test. So part of your post-test nursing care, you want to allow client to rest while you observe for passage of blood and abdominal pain. This will be signs of perforation, hemorrhage. You're looking out for signs of perforations, hemorrhage, respiratory distress. Again, you want to carry out follow-up x-rays. Afterwards, the client can resume his normal diet. Another gastrointestinal test we can look at is the ammonia test. which is used to detect liver disorders. Normally, the normal value should be between 15 and 45 micrograms per DL, 15 to 45 micrograms per DL. Teach your client or advise your client to avoid smoking before the test. You could also test for amylase level. Amylase actually, this test actually diagnoses pancreatitis and acute cholecystitis. Your normal values are between 6 to 160. You want to restrict fluids 1 to 2 hours before the test. And again, avoid opiates 2 hours after the test. Your lipase could also be, lipase test could also be done to diagnose acute and chronic pancreatitis, biliary obstruction, hepatitis, cirrhosis. Again, your lipase normal level should be less than 200. You want to keep this client nil per oral 8 to 12 hours before the test, and avoid opiates 24 hours prior to the test. Another test we can look at is aspiration of gastric content. Here, the purpose is to evaluate for presence of abnormal constituents, such as is there blood in your aspirate, is there abnormal bacteria, abnormal pH, or are there malignant cells? So part of your preparation for the test, NPO before test, NG tube is passed, and then the stomach contents are aspirated and sent for evaluation. Sometimes you could give histamine to stimulate hydrochloric acid secretion. The pH measures your acid and alkaline range, and the normal gastric pH level should be less than 4. Generally, overly acidic environment can lead to ulcerative activities within the digestive tract. Again, you could also carry out your QIAC test for presence of blood. Normally, blood should be absent. As part of your post-nursing care, you want to encourage fluid intake. We could also carry out upper GI series barium swallow. So for upper GI series barium swallow, you can see the client swallowing the barium, which is what the test is. So it's done. The purpose of ingesting this barium sulfate is to determine the patency and size of the esophagus, the size and condition of the gastric walls, patency of your pyloric valve, and also you're looking at the rate of passage to small bowels. So always keep this client nil per oral after midnight. Inform client that stool will be light colored after the procedure, so this should be expected. At the end of the procedure, encourage the client to take fluids. You could also give laxatives to prevent constipation. And again, remind him that your stool will be white from the barium swallow test. We could also carry out lower GI series barium enema. Here, there's installation of barium or a radiopaque substance into the colon through the rectum. Okay, and then we'll carry out fluoroscopic x-rays. So you're looking out for tumors, strictures, ulcerations, inflammations, or obstructions of the colon. So part of your preparations, you want to keep him on a low residue diet for 1 to 2 days. We can progress to clear liquid diet and laxative evening before the test, and then cleansing enemas until when it's clear morning of the test. So your post-test nursing care would include cleansing enemas after exam to remove the barium and prevent impaction. X-rays may be repeated after all the barium is expelled. So you want to compare your results. We could also carry out a paracentesis, a needle paracentesis. Okay, you want to aspirate fluids in abdominal cavity. It's used for diagnostic examinations of ascitic fluid and treatment of massive ascites resistant to other therapies. So you can see the ascitic fluid here that's piled up here. So you want to use this to withdraw and aspirate fluid. So it's usually done at the bedside, Client is in a semi-Fowler's position or sitting upright on edge of the bed. You want to empty the bladder prior to procedure to avoid accidental perforation. Your post-test nursing care will include check vital signs frequently for shock and or infection, report any elevated temperature or any abdominal pain to the healthcare provider, and observe for signs of hypovolemic shock. Okay, we'll move to blood tests and we'll start with a quiz. A client is admitted, or a client admitted for treatment of bacterial pneumonia has an order for IV ampicillin. Which specimen should be obtained prior to administering the medication? Routine urinalysis, complete blood count, serum electrolytes, sputum for culture and sensitivity. Airway problem, airway answer, remember your decision tree. So we know that pneumonia is an infection that inflames the air sacs in one or both lungs. So you can see this is inflamed, and then it may fill with fluid. So with pneumonia, the air sacs fill with fluid or pus. The infection can be life-threatening, particularly to infants and children and people over 65 years. And then they have these symptoms: a cough with phlegm or pus, there's fever, there's chills, there's difficulty breathing. So like I said, airway question, airway answer. So our option D is our correct answer option. A sputum specimen for culture and sensitivity should be obtained before the antibiotic is administered to determine whether the organism is sensitive to the prescribed medication. A routine urinalysis, complete blood count, and serum electrolytes can be obtained after the medication is initiated. So A, B, and C are what? Incorrect. So which blood tests do we look at? Let's look at our RBC count or erythrocyte count. Here, the purpose is to determine the actual number of cells in relation to the volume. The adult male should have between 4.6 to 6.6 million per millimeter cubed. For the adult women, it should be 4.2 to 5.4. And for children, it should be between 3.2 to 5.2. Remember, you need to memorize your lab values. There's no two ways about this. You need to memorize your lab values. Let's look at WBC count or your leukocyte count. Here you want to establish the amount and maturity of the white blood cell element. For adults, the level should be between 4.5 to 11 times 10 raised to the power 9 per liter. For children, it should be between 5,000 to 13,000 millimeter cubed, or 5 to 13 times 10 raised to the power 9 per liter. Depends on which values you are looking at, if it's a conventional or international values. Okay, for your hemoglobin, hemoglobin measures the oxygen carrying capacity of the red blood cells, and it determines the amount of hemoglobin in 100 millimeters of blood. Low HB levels can be seen with anemia, hemorrhage, or even in hemodilution. An elevated hemoglobin can be seen with polycythemia or hemoconcentration. So our normal ranges for men should be between 13 and 18 grams per deciliter. For women, it should be between 12 to 16 grams per deciliter. And for children, it should be between 11 to 12.5 grams per deciliter. HCT stands for hematocrit, which is a measurement of the percentage of red blood cells per fluid volume of blood. So you separate the red blood cells from the plasma, and your hematocrit is the percentage of red blood cells that represent the total blood volume. For a man, the normal hematocrit is between 42 to 52%. For a woman, it should be between 35 to 47%. And for a child, it should be between 35 and 45%. Okay, if we look at bleeding time measures duration of bleeding after a standardized skin incision. It is actually used for preoperative screening, and your normal bleeding time should be between 1.5 to 9.5 minutes. Okay, for your partial thromboplastin time, Your partial thromboplastin time, your PTT, which monitors effectiveness of heparin therapy. It also helps to detect coagulation disorders. The lower limit of normal should be between 20 and 25 seconds, and the upper limit of normal should be between 32 to 39 seconds. So our platelet count measures the number of circulating platelets, and this is used to diagnose hemorrhagic diseases and thrombocytopenia. A platelet count of less than 100,000 signifies the presence of thrombocytopenia. Your normal platelet count should be between 150,000 to 450,000 millimeters cubed. If we look at prothrombin time, which monitors the effectiveness of warfarin therapy, it could also be used to detect coagulation disorders. And we know that our normal value should be between 9.5 to 12.0 seconds. The INR stands for International Normalized Ratio. The INI is a laboratory measurement of how long it takes blood to form a clot. And this test is used to monitor the effectiveness of anticoagulant therapy. We regularly monitor the INR of people using warfarin in order to balance the risk of excessive bleeding when the INR is too high, meaning that the blood is too thin, against the risk of clotting or thrombosis when the INR is too low or the blood is too thick. So your normal value for the INR is 1.0. The INR is used to adjust the dose of warfarin, like we said. The desired INR will vary depending on what condition is being treated. So you need to be conversant with these common reasons for warfarin use, along with their target INRs. So you want to keep the patient's INR at between 2 to 3 for if the patient is on any therapy for atrial fibrillation, deep venous thrombosis, and pulmonary embolism. You want to keep the patient at between 2.5 to 3.5 if it's on a therapy for prosthetic heart valves disease. So you need to know these levels, 2 to 3 for AFib, DVT, PEs, 2.5 to 3.5 if he has a prosthetic heart valve. Again, we need to look at our ESR, your sedimentation rate. The ESR is the speed at which RBCs settle in a well-mixed venous blood. It can also indicate that there is an inflammation ongoing somewhere in the body. Okay, so for men less than 50 years, it should be less than 15 millimeters per hour. For men greater than 50 years, it should be less than 20 millimeters per hour. For women less than 50 years, it should be less than 25 millimeters per hour. And for women greater than 50 years, it should be less than 30 millimeters per hour. If we look at our GTT, your glucose tolerance test, this test measures the body's ability to secrete insulin in response to induced hyperglycemia. So to achieve this, you give your patient a glucose load, usually a very sweet drink of about 75 grams. Your normal blood values for a 75-gram GTT measured sequentially in a fasting state should be between 60 to 110 milligrams per DL. Then after the 1 hour mark, you sample your patient again, the value should be between, should be 190 milligrams per DL after 1 hour. After 2 hours, it should be less than 140 milligrams per DL. And at the 3 hour mark, normal value should be 125 milligrams per deciliter. Usually, we commonly think of using the glucose tolerance test for pregnant women to assess for the presence of gestational diabetes. And the test is usually performed somewhere between 24 and 28 weeks. Okay, other blood tests we'll look at will be your total cholesterol test, which evaluates tendency for atherosclerosis. Usually, the patient has to fast overnight, and your normal value should be between 150 to 200 milligrams per DL. Your LDL, which is your low density lipoprotein, sometimes it is called the bad cholesterol. This actually makes up most of your body's cholesterol. You also have the HDL. We also have the HDL for high density lipoproteins. Well, these lipoprotein tests, actually either the HDL or the LDL, they determine whether elevated cholesterol levels are caused by increased LDL or HDL. Okay, so high levels of LDL cholesterol raise your risk of heart disease and stroke. That's why they are called the bad cholesterol. So again, you need to fast, the patient needs to fast for between 12 to 14 hours prior to this test. For LDL, the value should be less than 160 milligrams per DL if no CAD, if no coronary artery disease, and the patient has less than 2 risk factors. It should be less than 130 milligrams per DL if no coronary artery disease and 2 or more risk factors. Or it should be less than 100 milligrams per DL if there is evidence of coronary artery disease. But for your HDL, for men, the normal value should be between 35 and 70 milligrams per DL, and for women, it should be between 35 and 80 milligrams per DL. You can also carry out your creatinine test, which is a test of renal function. You want to keep the client's nil per oral for 8 hours. Again, you need to list the medications the client is taking on your lab slip, because some medications can affect the creatinine levels. So for adults, your level should be between 0.7 and 1.4 milligram per DL. For children, it should be between 0.4 to 1.2 milligram per DL. And for infant, it should be between 0.3 to 0.6 milligrams per DL. Again, you can test your alkaline phosphatase level, which evaluates liver and bone function. Remember to keep your client's nil per oral for 8 to 12 hours. Again, these medications he might be on. Normal level should be between 50 and 120 units per liter. For infants and adolescents, it can go up to 104. We can also carry out CK tests, your creatinine kinase test, usually done to diagnose acute MI or myocardial infarction. If there's an MI, you usually see your CK creatinine kinase in the blood within 3 to 5 hours. Again, if you see the MM bands, if they are present on your test strip, it tells you there's skeletal muscle damage. If you see the MB bands, it tells you there's heart muscle damage. So that's why it's referred to as CKMB. So you're looking out for CKMB in acute myocardial infarction. We can also look at the serum albumin, which is used to detect protein malnutrition, and you would expect a normal value of between 3.5 to 5.5. We talked about the bonds, which is between 10 and 20 milligrams per DL, also done to evaluate renal function. There's also the triglycerides, which also helps to detect risks for atherosclerosis. We don't want them to be above 200 milligrams per DL. We talked about our ALT and AST, both of which are used to detect changes in the liver, in hepatitis, and we said their values are between 10 to 40 units for males and 10 to 40 units for males. So that brings us to the end of this course. I will advise you repeat this content and get accustomed to the values that we have mentioned in the course.